Let me introduce the next speaker. From Moldova, the National Public Health Agency, Dr. Silvia Stratulat, correct? She's the head of the Department of HIV Infection, Viral Hepatitis Surveillance at the National Agency for Public Health, Republic of Moldova. And the rest, you think it's a big one? She graduated from State University of Medicine and Pharmacy in Nicolet Testemitantu in 1995 and Management School of Public Health at same university in 2011. She has wide experience in the prevention surveillance of HIV infection and viral hepatitis. She has participated in the elaboration of several normative, informative, and educational materials in the field of HIV and viral hepatitis. Excuse me? Okay. It's a big CV where we have good speakers. So she has participated in the development of the law of the Republic of Moldova on prophylaxis of HIV/AIDS infection, National Program for Combating of Viral Hepatitis 2011-2025 year, National Program for Prevention and Control of HIV/AIDS and Sexual Transmitted Infections for the years 2006, 10 and until 2025. Standards and guidelines of HIV infection and viral hepatitis. She has provided several workshops and training for services providers in the field of HIV viral hepatitis. I think the rest is the floor is yours.
Thank you very much. First of all, I would like to thank you for the invitation and participate at this very important event for us, because elimination of Hep C virus is one of the big problems in our regions. I will try, please put my presentation. Thank you. Republic of Moldova has a high prevalence of chronic hepatitis and of course, and the liver cirrhosis and primary liver cancer. In 2022, above 75,000 people were recorded with chronic hepatitis, and the other 10,000 were recorded with liver cirrhosis. About 64% of hepatitis cases are caused by chronic hepatitis of viral etiology, and officially being recorded above 50,000 cases. Hepatitis C constitutes 31% in the etiological structure of viral hepatitis. In Republic, the registration of reduction of incidence of acute viral hepatitis B, C, and D, but there is increase the incidence of chronic forms of viral hepatitis, and hepatitis C in 2022 form chronics constituents 32.75 cases per 100 population. Viral hepatitis both chronic and acute form is registered predominantly among adults and with unique cases among children. Viral C hepatitis predominant in the etiology structure of acute forms in 2022 constitute above 68%. But the study that was provided in the country show that in our country we have very high seroprevalence of hepatitis C among key vulnerable population, among drug users, sex workers, and MSM. For example, hepatitis seroprevalence among drug users constituents in 2022 among 50%, among sex workers 8%, and among MSM around 5%. Compared with the general population, where the seroprevalence is 2.28%. In the last time, I would like to mention that the estimation exercise provided in our country in 2022 shows that in the Republic of Moldova there are around 55,000 persons infected with HCV virus, and in 2022 a total number of registered cases with hepatitis V virus was among 14 cases. That indicates in our country about 27% of patients with chronic hepatitis C know their status. In the last years, several measures were implemented in our country aimed to prevent hepatitis infections, early detection, and ensuring antiviral treatment. Was implemented screening testing with rapid diagnostic tests. GenExpert method is applied to confirm the diagnostic and monitor the DA treatment, and DA treatment is available, including in penitentiary system, and these drugs are purchased from the resources of state budget. Screening testing is available for general population in the health primary system, but I need to mention that the number tested person is very low. In 2022, only 50,000 persons were tested, but need to mention also that the around 4% of patients have the positive results. Also, testing is available for key vulnerable population that is done by NGOs. Also, you can see that a small number of people have tested for HCV, but for B hepatitis, and among key vulnerable population, positive results constitutes about 14%. In our country is accessible DA treatment that was started till 2016. Above 21,000 persons received this treatment, including in penitentiary system, and of course is available for children. The DA treatment is provided in accordance with our national protocols. These protocols are developed and in accordance with the current international recommendations and guidelines. At the moment, we don't have a waiting line for the DA treatment in country. Of course, is accessible and provides prophylaxis service for key vulnerable population. This service provided according to the standard that are approved. And I want to mention that the comprehensive package of prevention service includes testing, vaccination, and treatment for viral hepatitis. On this slide, you can see the number of beneficiaries of key prevention service for key population, of course, and number of syringes and condoms distributed among this population. But I would like to mention that we didn't achieve targets for 2022, and the syringes distributed among drug users in 2022 constituent only 140. This is more very small syringes distributed per persons. Of course, in our country, we provide some public campaigns for raising public awarenesses about hepatitis, but these campaigns are not financial from budget state and not have very important our impact of these campaigns. I would like to mention that the providers prevention service and the DA treatment were and subject we are nurturing and for refugees from Ukraine. This subject was discussed immediately after the start of the war in our country. In this accordance, order of Ministry of Health was approved that it provides for the provision of support for refugees, for also provision of prevention, screening, and test and treatment services. You can see the number of beneficiaries of refugees from Ukraine, number of syringe distributed visits among key population, and of course, and the support and treatment, and the DA treatment was provided. We supported by the Task Force for Global Health and Coalition for Health Global Hepatitis Elimination during the period 2020-21 in the Republic of Moldova, carried out the projects Hepatitis C evaluation to amplify the testing and treatment, and with this way I would like to say thanks for this support. Among this project was done situation analysis in the field of viral hepatitis. Based on the things identified and challenges on this analysis was developed the action plan for combating, eliminating is more say eliminating viral hepatitis in our country, but was done very important for us exercise estimation of people infected with HBV virus and C virus, and was done modeling exercises on elimination C virus. The analysis was done with implementing specialists from national levers and territories, or collected a lot of information of data from territories on the field of surveillance, prevention services, care and access to treatment, and the laboratory capacity for diagnostic of viral hepatitis, and of course monitoring and evaluations of hepatitis. The main challenges identified following the analysis are low HCV testing, including in key population and in general population, poor implementation for laboratory screening and diagnostic service on viral hepatitis, and of course, low financial coverage for screening testing. Also, the challenging is insufficient information for general population on viral hepatitis, lack of specific training programs for NGOs and for specialists from healthcare system, lack of support for patient to retention and adherence to the DA treatment, and lack of financial resources for implementation of activities on public awareness is rising about viral hepatitis. Other challenges is above surveillance. In our country, we understand we have insufficient epidemiological data. In country is a lack of national electronic register for tracking patients with hepatitis and liver cirrhosis, and of course is insufficient operational research on and epidemiological studies in testing, diagnostic, and treatment. Using on these things was developed, I said, the plan for elimination of viral hepatitis. This plan includes activities, interventions, and targets for main important areas: prevention, treatment, care, monitoring, of course, diagnostics, and strengthening on epidemiological and surveillance of viral hepatitis and ensuring data quality. Using the tool Hep C Elimination with the support of Howard Medical School and Massachusetts General Hospital, of course with the Coalition for Global Hepatitis Elimination and Task Force for Global Health. We, in our country, was done elimination modeling exercises that shows we had we use the elimination scenario screening rate annually 20% and 80% treatment rate, and this elimination scenario indicate for Republic of Moldova need in the last and in the next 3 years to be screened around 500,000 people every year, and in the next 3 years we need to confirm and be done confirmation testing around 20,000. Also, in the next 3 years, every year, we need to cover with treatment and diagnostic and around 15 cases, people diagnostics. This scenario will ensure us to provide care of patients with viral hepatitis and achieve non-viremic in the country versus counterfactual scenario that doesn't achieve non-viremic situation. This scenario is also will give us possibility to decrease costs after 2030, and also we can see this scenario, if it will be implemented in Republic of Moldova, allow saved about 80,000 million dollars to 2015. Thus, Republic of Moldova has many priorities, but one of these is ensuring the strategical plan for hepatitis C elimination, strengthening viral hepatitis diagnostics capacity, and provide ensuring testing. Of course, increase quality and accessibility to healthcare system, including for DAA treatment, strengthening epidemiological and surveillance viral hepatitis, rising public awarenesses of viral hepatitis, and of course, provide prevention service and treatment service for high-risk groups, injection drug users, sex workers, MSM, etc. I would like to say thanks for attention. If you have many questions, I am disposed.
Excellent presentation. Thank you so much for both of you. Questions for Silvia? You have a robust set of data. You have some of the best data on a variety of different services needed to eliminate hepatitis. But yet you feel like you need to have even better data. And I just wonder, what do you think would be improved with more data?
Yes, at the moment we haven't data on liver cirrhosis distributed by the etiological virus hepatitis. It is one of the situation, because we don't have possibility to measure the impact of our activities in the country. We need to collect data on from laboratories about testing, because the laboratories doesn't have a system and collect all data from all laboratories, not one from public health institutions, and private laboratories need to report this data. And we can select only data for testing provided by rapid tests, because the system was the test was implemented 2 years ago, and I put these tests and Excels, and our institution reports this data. Also, I think we need to have more data about chronic cases, chronic patients, of course, and to track the patient in treatment. This is very, very important.
Thank you.
For us.
Yes, here you go.
I'm sorry, I'm Liana Gheorghe, I'm from Romania, and several questions for you. First of all, because this is a topic, I would ask how do you perform testing? Every practitioner, family practitioner, or who does this? What percent, what number annually of treatments are covered or reimbursed by the state of Moldova? That is the first one. Then I'm very interested in vaccinal coverage in newborns in Moldova, because I know you have a huge population infected with HBV, and mostly HBV, HDV. And if you perform reflex testing, or if you, which is your policy in testing HBV infected patients to discover cases of co-infection with Delta?
Thank you. These questions is very important. I would like to say the first questions. Testing with rapid diagnostics are available at the primary health care points, and they is done in the laboratories. Of course, is every healthcare primary point, if he have the laboratory, can do this testing for populations. This is for us very important. It is accessible, the testing in rural population. That is very, very important for us. Second questions was about vaccinations. I didn't provide this information, but I would like to mention that vaccinations of newborns is providing within the vaccination universal program that is not part of the program of combating viral hepatitis. But the high-risk groups, including healthcare workers, high-risk groups, drug users, MSM, and others, are part of this program on this plan, and we provide vaccination. We have good coverage of vaccination about with scheme 3 doses, and in the last years we have good results with coverage of vaccination. I think it's a problem for vaccination that person that was born till 1995, because in our country vaccination, universal vaccination was started until these years, and now we need to reach that people and to apply the vaccination to them. You asked me about testing on B virus and the D virus. Of course, there is accessible testing for B virus with rapid testing, and if the person identified with the result positive, they can be tested on D virus, and of course according with the algorithm of test, and after the present this result.
Thank you. Just one follow-up question, please. You mentioned that the testing was being done by primary care providers. Is the treatment also delivered by primary care, or is there a referral system where people are referred for treatment?
At the moment, the treatment is available and provided by infectious diseases and gastroenterological diseases, but we think this is very important to decentralize and be provided by primary health care workers.
Thank you. And maybe one last question is about prisons. Is treatment happening for the people in prisons in Moldova?
Yes, this is accessible for this kind of people that are in penitentiary system.
Thank you very much. Thanks, Silvia. Very much.
Thank you. Thanks.